What if the reason you're still injured isn't your training plan, but rather the missing 10 minutes from your exam? I'm Dr. James Repko. I'm a board-certified podiatrist practicing in South Tampa, Florida. I love treating runners, triathletes, racket athletes, CrossFitters, active duty military members, and also the weekend warriors and busy parents around the area. We take a conservative-first approach to getting you back to doing what you either have to do or love to do. My goal by the end of this video is that you'll be able to evaluate a sports medicine podiatry focused clinic, what technologies and philosophies they should have that will help shorten your recovery, and what questions you can ask to protect you from wasting your time so you can get back to doing what you want to, need to, or love to be doing. I completely understand how pain can sideline your life and your identity. Oftentimes, gadgets aren't the answer, but an ancillary support. And the same thing exists with cortisone. You do need to be careful with cortisone. It's a great tool, but it has to be used appropriately. And your pain is a signal that something is wrong. You actually want some level of pain. Another common thought is that rest is going to get you better. But rest, while it can allow the injury or source of pain to calm down, doesn't address the underlying cause. If you return to doing what you were doing before that caused your pain, it's very likely that your pain is just going to come back even worse level with worse injury. So the solution is always in having the right assessment done off the bat and then developing the right treatment plan and often exercise loading plan to allow you to return to doing what you want to do. In my opinion, the key in sports-focused podiatry is identifying an overload pattern, a tissue overload that is leading to your pain, or a possible weakness somewhere else that is leading to the tissue overload. That is the key foundation of what you need to attain in order to solve your pain and prevent your pain from coming back. Anybody that's active needs this. Otherwise, you're doomed for a repetitive cycle of continued pain. My 5 non-negotiables when choosing a specialist are: 1, first and foremost, they have to have an evidence-based approach and a conservative first treatment approach with an escalation ladder. Start low and work your way up. I'm constantly citing this to my patients. You want people that have great diagnostic depth. So oftentimes a sports-focused practitioner will have diagnostic ultrasound, diagnostic x-rays, and access to MRIs and CT scans. They might even be able to do a gait analysis on you or a pressure analysis. You also want somebody that understands your sport, the mechanics of your sport, and has literacy around your sport. Somebody that has possibly played or understands the demand and the mechanics, dynamics of whatever sport that you are playing. You want somebody that also has integrated care. They have good relationships with outside physical therapists or strength coaches. They also have clear communication with those providers. You want somebody that has access to an orthopedic surgeon, as well as some things might be showing up in your foot, but could be coming from elsewhere and require a more in-depth analysis of another body part. Knowing your limits is key as a practitioner. I know what I'm good at. I know what I'm not good at. I'm always happy to refer people out if I don't think it's something that I can help. And then lastly, what you need is outcome transparency. So you need somebody that's going to establish clear goals from the start with timelines and a outline of what success is going to look like. Now, it can be difficult to determine timelines, but you want regular check-ins. A lot of times people want, but with athletic and sports injuries, often not the case. The assessment and the initial plan are the first step. It usually occurs over multiple visits. You didn't just get this pain all of a sudden. You got it from weeks, months, and sometimes years of doing things over and over again and ignoring little stressors that led to where you're at today. 2 things that are extremely important as well in developing a treatment plan are layered approaches. So you want somebody that's going to be able to support the foundation of your house with multiple pillars, because often one thing is not going to get you better. I like to incorporate splinting, offloading, and then healing. Those are the 3 key factors to any treatment plan with any type of injury in my book. This layering works because it reduces inflammation, it decreases load, allowing you to heal, it applies the appropriate load so that your body has stimulus to appropriately heal. We correct the underlying mechanics that got you there in the first place, and we are building tissue capacity so that this does not happen again. We even incorporate regenerative options like platelet-rich plasma, extracorporeal shockwave therapy, MLS laser therapy to expedite that process in our practice. What type of a roadmap should you look at to getting back to doing what you need to or want to be doing, love to be doing? First, you need to calm the tissue down. Second, you need to restore range. Third, you progressively load. Fourth, you do sport-specific drills. You test, assess, and let your pain guide you. You want your pain at a level of 3 to 4 out of 10, something that's not limiting you the next day or getting worse week after week. Those are key factors to you getting back without hurting yourself or delaying progress along the way. Here's some key questions you can ask somebody if you're unsure about what they're doing or what their plan is. You can ask them, how many athletes do you treat like me each month? How many people do you see like me each month? How many people have you successfully gotten better in the past with this? How often are you seeing this type of an issue? What's your 30,000 foot view for your treatment plan? I have step 1 today, but what if step 1 doesn't work? What do the next steps look like with this? And lastly, you can ask, what does a 6 to 8 week successful outcome look like? Is that a reasonable expectation or unreasonable expectation? Being upfront about that is critical to framing your own expectations so you know what you need to do. Clear communication from you and your physician is critical. I really like to highlight the 30,000 foot view from A to Z with my patients. We're going to start here. We're going to progress to this if it doesn't work. And lastly, we have this on the table if all else fails. To summarize, what you need to do is you need to pick process and systems, not slogans, not catchy phrases, not trends, and not really personalities. If you're in Tampa and you're in need of a second opinion, we're happy to help out. Just call us at Bayshore Podiatry Center. We're here to get you back on your feet moving forward.